ahead, a shocking health scare for TV host Deborah Norville. What a viewer noticed and how you can know if you should be checked out. A doctor joins me next. If you watch Inside Edition, you may have seen this very personal message from host Deborah Norville. Watch.
And a long time ago, an Inside Edition viewer reached out to say she'd seen something on my neck. It was a lump. Well, I'd never noticed the thing, but I did have it checked out, and the doctor said it was nothing, a thyroid nodule. And for years it was nothing, until recently it was something.
That something was thyroid cancer. And yesterday, she underwent surgery to remove the nodule, and she posted that everything went great, which is wonderful to hear. And she's not the first TV host who can thank a viewer for urging them to check out something suspicious. Tariq El Moussa, who is the host of HGTV's Flip or Flop, had the same thing happen. He is now cancer-free. But I want to bring in Dr. Johanna Bendell to talk about this disease. She's the head of cancer research at the Sarah Cannon Research Institute in Nashville. Thanks for being with us, doctor, because I actually had this happen. A viewer who's a physician said he noticed something right here. I should get it checked out. I actually scheduled a physical. Most people obviously don't have physicians at home looking at them. Why aren't we noticing ourselves if there is an issue?
Well, it's really hard to examine your neck. And we don't often think about checking our thyroid. We think about our breast exams if we're women or other exams that we might do. But we do see patients that have thyroid nodules. Now, the good news is if you find a thyroid nodule, only 4 to 6% of them end up being a cancer.
And what to look for is the most important thing. And let's show an image of the thyroid itself. Tell me what it would look like and what the symptoms would be.
So oftentimes they're found incidentally when patients are having their physical exam with their primary care physician, when the primary care physician actually checks the neck and feels the thyroid and may feel a nodule there. Sometimes it's something that visibly appears. You notice your neck look a little bit different or a little bit fuller in the mirror. And then sometimes people will have symptoms of trouble swallowing or hoarseness when they speak, or sometimes even trouble breathing.
And this is very treatable. That's the good news, right?
That's the best news, is most of these are treatable. Most of the nodules don't end up being cancer. But if the nodule ends up being cancer, there's a 99%, actually 99.9% chance of curing the thyroid cancer with surgery.
So many women, though, separate from the cancer, have issues with their thyroid. So there's a bigger message here that although it may not be cancer, there could be other trouble, right?
Yeah, so the thyroid is responsible for making thyroid hormone, which is so essential to how we behave, our levels of fatigue, what we're eating, whether or not our hair is falling out, how we're feeling in general. So sometimes when a patient comes in and they're just really tired, or they're noticing that their hair is falling out, or they're noticing that they're eating a lot or eating very little, but yet gaining weight, sometimes that can signal an abnormality in the thyroid hormone. And so your physician should be checking your thyroid hormone to see if there are any issues that are there. And oftentimes those issues can be very easily treated.
And also the point of go get your yearly physical, have these things checked out, because so many people put that off. Dr. Bendell, thank you so much for your insight. We appreciate it.
Thank you.